About myself, for those of you that don't know me. No, there we go. My name is Elizabeth Goldstone, and I'm a board-certified behavior analyst, and I practice in the Lower Mainland, primarily in White Rock, Surrey, and Langley. And right now, my practice is currently taking place mostly over telehealth during the COVID-19 pandemic, just to keep everybody safe. And in my practice, I work with infants, children of all ages, families, and school administrators. And I work in home and school settings. My heart first came to be with the behavior analytic world when my sister was diagnosed with autism at the age of 3 years old. And I was always very actively participating in her home ABA program. So I really wanted to give back to the community and also just continue with my passion of helping my sister and others who have been diagnosed with autism. And a fun fact about me, I am a plant lover. You can probably see right there. That's just a little bit of my collection. All right, so tonight we are here to talk about data collection and data analysis for parents. Oops. Sorry, I'm just trying to move my my picture of myself here.
It always shows off to the side for us, so it doesn't bother us at all.
No worries. It was in the middle of my screen, so I just couldn't see my... Okay, we're good to go. So data collection and data analysis for parents, that's what we're here to chat about today. So the goals for this series are to empower parents to participate in their child's home ABA program, to provide parents with the tools needed to assess their child's progress and evaluate the effectiveness of their child's home ABA program, and to reduce the barriers associated with parent education. So this presentation will cover principles and terminology from a variety of behavior analytic approaches, the school system, and different service providers. Please ask questions throughout the presentation. I will stop speaking regularly to cover your questions. And if you attended the last talk live or viewed the recording, if you have any questions from that presentation, please also ask those in the chat box or the question box, and I'm happy to answer any follow-up questions from that presentation as well. Okay, so a few topics we are going to cover in this presentation. We're going to review the prerequisite terms, behavior. We will go through operational definitions, categorizing behavior by function, functions of behavior, how to determine the function of a behavior, measuring behavior, recording behavior, skill acquisition data, graphing 101, types of graphs, graphing basics, components of a line graph, and also data analysis, and graphing data as well as criteria and criterion. So I will help you better understand all of those terms today by translating them for you. All right, so in this presentation, I will primarily use the term parent to describe the adult caring for the person receiving ABA services, and I will primarily use the term child to describe the person receiving ABA services. The term parent can be substituted for caregiver, guardian, or anybody else who may be caring for the individual, and the term child is applicable to any learner, client, or student. So, parent participation. Parent involvement is one invariable factor and an integral part of success in early intervention programs for children with autism. Parent involvement can maximize the child's learning rate and skill development. Parent participation can support generalization of skills outside of ABA sessions. And parents must provide informed consent for program changes. So that's really important that parents do participate in their child's home ABA program. All right, so I have a little QR code here on the left side of the screen that will direct you to the BACB ethics code. So that is the ethics code that board certified behavior analysts must abide by at all times when we're practicing. So the ethics code in section 1.05b says that when behavior analysts provide behavior analytic services, they use language that is fully understandable to the recipient of those services, while remaining conceptually systematic with the profession of behavior analysis. They provide appropriate information prior to service delivery about the nature of such services and appropriate information later about results and conclusions. So in sum, we are responsible as behavior analysts for explaining all behavior analytic terms to our consumers, families, clients in language that is understandable to them. So we need to translate our behavior speak or our scientific language into more understandable terms. And that's really important because if you don't understand what we're saying, you're not going to be able to provide informed consent for the services you're receiving. So let's start by reviewing from last time. I talked a little bit about behavior at the beginning of my talk. So I will reference the term behavior a lot during this presentation again. In this presentation, behavior just refers to things that we do, positive things and negative things. The term target behavior is the behavior targeted for change. So some examples of behavior are increasing the accuracy of printing letters or decreasing bolting into the street. So just because I'm saying behavior, it doesn't always have to have a negative association with something that we're, say, trying to decrease or replace. So last time I spoke a little bit about how we describe behavior, and I'll review that again with you now. So there's a few different ways that we can describe behavior. There's the topography of behavior. So that's what behavior looks like. So we could describe hitting as hitting with an open hand. That's what a hit looks like for that person. Or using a pincer grasp to place a block onto a tower. So a pincer grasp is kind of holding an object like this with your index finger and your thumb. So that's what the behavior looks like. The frequency of a behavior is how often the behavior occurs. So say 10 times in one home ABA session is the frequency of a certain behavior. The duration is how long the behavior occurs for. So a girl could laugh for 3 minutes, or a child could cry for 2 minutes. Those are some examples of duration. So that's the length of time that a behavior occurs for. The rate is the number of events of the behavior in a particular time period. So if we say a behavior occurs 10 times in 5 minutes, that is the rate of the behavior. So it's the number of times that behavior occurs over a certain number of minutes. The magnitude is the size of the behavior. So this describes the intensity. So was it a touch or was it a punch? That describes the magnitude or the size of the behavior. And finally, latency, and that is the length of time between an instruction being presented and the behavior occurring. So for example, if a child is struggling to put a piece on their Lego tower, the latency to ask for help or the time it takes for them to ask for help may be something that we're measuring. So maybe it takes them 10 seconds before they ask for help to place the Lego onto the tower. All right, so that's the end of the review from last time. Those are some prerequisite terms that are important for the talk today. So I'm going to jump right into this. I tried to sequence this talk the best that I can. There's a lot that goes into data analysis and understanding how data works. So please do ask questions or ask for clarification if things get a little bit confusing. So first, I'm going to talk about operational definitions. The translation for this term is what the behavior looks like. So operational definitions talk about things like observable, measurable, and repeatable. So observable is that the behavior can be defined in terms that other observers can agree upon the occurrence or non-occurrence of the behavior. So in order for us to define a behavior, it must be observable. Also measurable. So we must be able to measure occurrences or events of the behavior. So we must use some of the descriptors of behavior that we talked about in an earlier slide, like count, frequency, rate, magnitude, and latency. Those are all ways that we can measure behavior. And repeatable. So the behavior must occur repeatedly over time in order for us to measure it.
Hi, Elizabeth. Sorry, I was trying to tell parents to post their age of their child, where they live, and whether or not they do ABA, and I only set it to us panelists. So I was just putting that
Okay,
back in, but my
great.
computer copy and pasted the wrong thing. So I put in a very nonsensical statement. So anyway, and if everybody could please type in your child's age and actually whether or not you're a parent, where you live, and thanks. That's it.
Perfect. Thank you.
Thank you,
All
Nancy.
right. So with operational definitions, they tell observers what behavior is and is not. So this is really important when we are measuring behaviors or skills in your child's program. Everybody needs to be on the same page about what skill we're looking for or what behavior we're looking for. So I put together some examples of operational definitions for certain behaviors. So the first one is chewing with mouth open. So here's a operational definition for chewing with mouth open. So chewing with the mouth open is defined as biting down on food with teeth and or food visible through the plane of the lips, may or may not produce an audible sound, does not include chewing when the lips are completely closed. So you can see that this operational definition includes a descriptor of what the behavior is and what it is not. And it also provides information on the actual observable part of the behavior. So the teeth or food is visible through the plane of the lips. Another example is throwing objects. So throwing objects is defined as propelling any object through the air with the object making contact with furniture, the floor, or a person. And it does not include opportunities to throw a ball in the student's throwing a ball program. So many of my students who are young learners have physical activities that are programmed into their home program. So we want to make sure that behavior interventionists are not intervening when the student throws a ball in their throwing ball program. So just to be sure, we will put a note in here saying that throwing objects is not relevant when we're throwing a ball. So those are just a few examples of operational definitions. And it's important to note that these definitions are different for every single learner. So I don't copy and paste my definition for throwing objects for any of my learners. It looks different for every student. It's the same thing with any other behavior or skill that we're trying to measure. What it looks like will always vary. Okay, so now we're going to dive into what the function of behaviors are. So we can categorize behavior by function. The function of a behavior is the reason why we do a behavior. So let's see. I wonder why we do behaviors. So behaviors are learned through interactions with the environment, social and physical interactions. And if we want to change the behavior, like increase it, reduce it, or maybe shape the behavior, so that means changing it somehow, then we need to know what is maintaining that behavior. So why are we doing that behavior in the first place? It's important to know the function of a behavior because it can inform treatment decisions. So we reference the literature. We are a science-based profession. So we reference the literature when we are going to design an intervention for a particular behavior. But that behavior may occur for different reasons in different participants in these studies that we're referencing. So it's really important for us to know why the behavior is occurring so that we can reference literature that's accurate to get an accurate look at what a treatment might be for that behavior. Determining the function also helps us choose the right replacement behavior. So when we're selecting a behavior to, let's say we have a challenging behavior like throwing objects, when we are determining what to replace that behavior with, so a more socially appropriate behavior, we need to know the function because the function has to match. The replacement behavior needs to have the same function as the behavior that we're trying to reduce. Function can inform treatment decisions, so we need to reference the literature. And I say function can inform treatment decisions because we don't have to know the function to intervene on behavior. And we know this because of Dr. Greg Hanley's practical functional assessment or skills-based treatment, where we no longer have to identify the function of a behavior in order to intervene on it if we're using that procedure. Determining the function also helps us choose the right replacement behavior, as I said earlier. So there are 4 main functions of behavior. Sorry, I'm just going to close my window here. There is attention, tangible, escape, and sensory. So those are the 4 main functions of behavior. So I'm going to go through those now. So the first one that I'm going to talk about is attention. So a behavior that's function is attention is one that receives attention from the environment. Attention is the reinforcer, and attention maintains that behavior. So here are some examples for you. The man on the right is diving or belly flopping off of a large rock into a very cold lake. His friend is there to take the photo. His behavior is maintained by social attention that he gets from his Instagram followers. He will do more risky, adventurous behaviors in the future as a result of the social attention he gets on social media. So the function of his behavior, doing kind of risky, adventurous stunts, is attention. He gets attention for doing that. So that's what's going to maintain his behavior over time, and he's going to do more risky, adventurous stunts in the future. Another example is a child yells, "Ah!" every time he needs help completing an activity on his iPad app. Mom comes over and says, "What's wrong?" every time the child yells, "Ah." So every time the child yells, mom comes and gives him attention and says, "What's wrong?" And that's what's maintaining the yelling "ah" over time. So that's the function, of that behavior. Okay, so another function of behavior is tangible. So that is accessing a preferred item or activity. So an individual is doing that behavior to access a preferred item or activity. Receiving the item or activity is the reinforcer. That is what's maintaining the behavior over time. So some examples of tangible behaviors are a child says, "Can I have a lollipop, please?" And mom says, "Yes," every time the child uses her words to request a sweet treat. So that child will continue to say, "Can I have a lollipop, please?" to get something tangible. That's the function of asking for a lollipop. A child screams "McNuggets" every time he spots a McDonald's sign. The child continues to scream until mom turns the car around to get McNuggets. So the function of that child's behavior is to get something tangible, which is McNuggets. You can tell I was probably hungry when I was writing these examples. Functions of behavior: escape. So looking at escape as the function of behavior. So with escape, it's avoiding something that we don't want to do, see, or engage with, for example. We're avoiding the task, the item, the person, whatever it is. And that avoidance is what reinforces our behavior. Avoiding the task, item, or person maintains the behavior over time. So here are some examples of escape function behaviors. So when I leave the house for a walk in my neighborhood, I take a quick look left and right as I walk through my gate to avoid any neighbors that may want to talk to me. So if I want to go for a quiet walk and I only have 10 minutes to do it, I take a quick look around because I have very friendly neighbors and they'll want to talk to me. So I'm trying to escape that social interaction. Another example is a child runs out of a therapy room crying every time the BI brings out a puzzle. So that child is trying to escape having to complete the puzzle or the demand. And another example is a child asks for a break during their session. So again, all of these behaviors don't have to necessarily be challenging or negative. Every behavior we do in life has some function to it, and it's positive functions too. It's not all negative. So asking for a break is an appropriate way to escape a demand. And the final function of behavior is sensory or automatic reinforcement. And that's where someone accesses a sensory consequence and their behavior is maintained by that. So some examples are a student lines up his toys because he enjoys the visual perceptual input of seeing the toys in a line. I click my pen repeatedly in a meeting because it makes me feel less nervous. It's another sensory function behavior. And a child flaps his hands when he sees his dad walk through the door after work because he's excited to see his dad, and flapping magnifies the feeling of his excitement. So that's another behavior that's maintained by sensory function. Okay, I'm going to briefly pause to see if anybody has any questions. And I'm actually just going to move the chat box to my other screen here if I can, because then I can see.
There's none so far.
Okay.
And yeah, I think these functions of behavior are very important because a parent or a teacher even may do something that they think is going to help reduce a behavior, but in fact, it may actually be helping support that behavior. So it's really important to understand that one behavior can actually have, for one child, have a different function, and another child might have a different function for the same behavior.
Yes, exactly.
Okay, no questions so far.
All right.
And just so you know, we have a parent running 2 home ABA programs for 6 and 3-year-old, and a 5-year-old who's been in a clinic base for now. So it's good to see what's going on there. So there we go.
Great. Awesome.
We have a couple others here, but they haven't checked in yet. So if anybody else wants to tell us where they live, we've got Langley and Surrey so far, and how old your child is.
Excellent.
Okay.
I will continue. Thank you. And welcome, everybody. Thank you for putting your information in the chat. That's awesome. Okay, let's keep going. So how do we determine the function of a behavior? This is a bit of a complex process, but I'm going to explain the pieces of it that are the most important. So there are a few different ways that we can determine the function of a behavior. So in the purple, you can see that one way is by doing a functional analysis, or an FA. And that is an experimental style analysis of all 4 functions of behavior. So this is something that it's not done as often as it used to be because we have Dr. Greg Hanley's practical functional assessment now, which can be much more ethically implemented and maybe even more effective than a traditional functional analysis. But for a traditional functional analysis, a practitioner would set up 4 conditions that the student would take part in. So in one, the practitioner would provide attention for the behavior. In another, they would just observe the student, and that would be the sensory condition. In another one, they would provide a tangible item when the student does the behavior, and so on. So this one, again, it's quite complex and advanced. So that's just kind of the Coles Notes version of it. But there's lots of information online if you search functional analysis that you can also take a peek at if you're really interested in all of the technicalities of that procedure. So other methods are indirect methods. So that's in the orange there. So those are things like interviews, checklists, rating scales, and questionnaires. So there are some kind of standardized questionnaires that we can use, or just interviewing parents as well. And then finally in the blue, there are things like ABC recording. So that's where we record the antecedent, the behavior, and the consequence. And there are also scatter plot graphs. Okay, so I'm going to focus on talking about ABC recording because this is something that as a parent, a practitioner may ask you to do. So a ABC recording is where the observer records occurrences of the behavior and environmental events. So I'm going to just start by reviewing the 3-term contingency, and this is something that I talked in detail about in the last talk. So with a 3-term contingency, we are looking at the A, B, and C. So that's the antecedent, behavior, and consequence. So this is one way that we can figure out why a behavior is occurring, figure out its function, is by analyzing the antecedent, the behavior, and the consequence. So the antecedent, to review, is an event that occurs before the behavior. So some examples: a demand is presented, like get your shoes, the school bell rings, or a sibling turns on the TV. So those are all things that could happen before the behavior happens. Then we have the behavior, and that is what the person does, and it's observable. So this is where your operational definition would come in. That's the description of the behavior that everybody can observe the same way. So examples of behavior: the student runs away and says no shoes. The student walks to his classroom door and lines up. The child demands or requests, I want TV, please. So those are all examples of behavior. And consequence. The consequence occurs in the environment immediately after the behavior. So some examples are: the BI states, let me help you, and the BI gets the student's shoes. Or the student's EA greets him and says, nice to see you today, Joey. Or the BI says, you can watch TV on your break, first finish your spelling. So those are all consequences that could occur after the behaviors I discussed in the previous slide. So going back to ABC recording. So we would record those things that I just discussed and those examples on charts so that we could see if there's some kind of pattern to the behavior that's occurring. So typically we will complete ABC recording when we are looking at behaviors that we would like to replace and or reduce. Okay, so these would be for challenging behaviors. And there's a few different ways that you can record ABC data. Now, every practitioner has their own preferred method of recording. I've put 2 different examples here. So the top one is one example, and that's where the observer, so that could be the parent or it could be the BI, whoever is the implementer in that moment, they would record the date and the time that the behavior occurred. And for this specific one, they would just check off what the potential antecedent was. So it could be an instruction was presented, maybe attention was diverted away. So maybe mom was playing a game on the iPad with Joey, and then all of a sudden she heard the doorbell ring and she went to get the door and her attention was diverted, and then Joey starts screaming, let's say. Social interaction could be another one. So that's maybe where we walk into the home and say, hey, Joey, so nice to see you today. Maybe that was the antecedent. Engaging in a preferred activity. So that might be the child is reading a book if that's something that they really enjoy. Or a preferred activity is removed. So, okay, you know what? It's time to put away the iPad. We're going to have dinner now. Or alone. So that's maybe when the student might be doing nothing. So they might just be walking around the room. They might be engaging in stereotypy or self-stimulatory behaviors. So that might be when we check off the alone option there. And then for behavior, this would be individualized based on the student. So I've just put a few examples here of common behaviors that I treat. So things like vocal protest, and that's where the student might be screaming, crying, saying no, engaging in some kind of refusals. Elopement, which is leaving the area. It could be bolting out of the house, or it could just be running out of the room and running into their bedroom and slamming the door. That could be elopement. Again, the operational definition of these behaviors will vary depending on the learner. Pulling hair could be another one, or biting finger. And again, biting finger could be the student biting their own finger, or it could be them biting someone else's finger. So for this one, we would just check off what behavior occurred. And then again, we would check off the consequence as well. So what happened after the behavior. So looking at patterns from these types of recordings can help us determine why a behavior is occurring. Now, the one on the bottom there with the blue writing is another version of ABC recording, and this is one that I actually use in my practice. So for this one, we are writing the date and initial, and then we're writing down the antecedent. So for this one, it's not a checklist. The implementer, so the parent or the BI, is actually writing in the details to this. So in my chart here, I like to know the location of the student and the location of the adult and the activity of the student and the activity of the adult. So that will tell me information about the antecedent. That will tell me what happened before the behavior. And then we look at the behavior. So in this example, the student screams and threw the blocks towards me when the ramp fell down. He ran into his bedroom and slammed the door. So that is my description of the behavior. So that's what happened. The consequence is what occurred immediately following the behavior. So what physical action did you as the implementer take? So I walked to the student's door. And what did you say? I'm sorry that your ramp fell down. Let me know if you need help to calm down. So for this one, I want to know exactly what was said and what physical action was taken. I always preface this for my BIs and my families that I'm not looking for you to always do the right thing. Of course, BIs, I want them to follow my behavior plan, but people make mistakes in the moment when challenging behaviors are occurring. It's really hard sometimes, and I understand that. So I always tell people I will never give you trouble for writing down exactly what you did and what you said, because that's really important in determining why this behavior is happening. That's our key to unlocking how we can treat this behavior, is complete honesty. So it's really important to say exactly what you did and exactly what you said. And if you yelled, it happens, it's okay. So write that down too, because that could actually be what's reinforcing that behavior, is that level of attention. That yelling could be what that person wants. And then finally, the duration of the behavior. So about how long did it occur for? I don't ask my BIs or parents to carry around stopwatches. This is just a ballpark number. So like, did it occur for like 1 minute or did it occur for like 30 minutes? So I just ask for their best guess at a number for duration. So that's just two examples. Again, every practitioner will have their own style of ABC recording. If you search ABC recording or ABC chart on Google, you will also get tons of different formats. So that's something I'll actually cover in my next talk. Is I'm going to talk about how you can best design data-based measures so that you can take data for, if you're going to a doctor's appointment for a specialist and you want to take some data to present to them, or if you just want to start taking data to see if you can figure out why your child is doing a behavior or something like that, or if you're waiting for diagnosis as well and you want to start taking data before you hire a BCBA. So I'm going to cover all of that in the next talk as well. So after collecting sufficient ABC data, we may be able to determine the function of the target behavior. So sometimes we can determine the function from that and sometimes we can't, but it's important to take a look at that data. A recommendation for treatment will be provided and introduced and implemented by the BI or parent or the treatment team. Okay. Any questions about any of those things? I don't see any in the chat, and I cannot see the question box.
Sorry, I was getting a phone call just when you asked that. No
No
questions
worries.
there.
No questions, but I had a question. I don't know if there's ever a scenario where there may be two concurrent antecedents.
There definitely can be. That's a really good question. So there can be more than one antecedent, and sometimes it's really challenging to identify the antecedents. It could be something as simple as the wind blowing. That could be an antecedent to a behavior. So yes, there can be multiple antecedents. And that's actually also a good question, because that leads me into, there's also sometimes multiple functions for the same behavior, which makes things tricky too. So when I ask parents to record ABC data or BIs, I just ask them to record as much as they can about what happened before the behavior. It's not the parent's responsibility or the BI's responsibility to determine what the actual antecedent was. That's something that usually I can determine from looking at a bunch of different ABC recordings of the same type of behavior. And I can say like, okay, I think it's this, or I think it's this and this, or it could be this or this, to help us narrow down what exactly might be causing that behavior to occur.
Great. Thank you so much for answering that. Thank you.
No worries. Thank you for asking. All right, I will continue. Okay, so now we're going to go into measuring behaviors. So ABC recording is one way of indirectly measuring behavior. It's a descriptive way of measuring behavior. It's not quantitative or numerical data. There's not a number associated with it, but it can be very, very helpful data. It gives us more information than some of the numerical data we can take. So let's talk more about measuring behaviors. Okay. Data. I say data, you could call it data. Data is everywhere. Data for everyone. Show me the data. So data is very, very important in the field of behavior analysis, because that's how we determine if our treatment is working. Okay, measuring behaviors. So there are a bunch of different ways that we can measure behaviors, and these are the most common ways. So the first one is count. Count is the number of times a behavior occurs. So you count the behavior. There's also frequency that I talked about a little bit earlier. That's the number of times a behavior occurs within an observation period. The duration is how long the behavior occurs for each time it happens. And then there's also time sampling, and that's when we look at a period of time and record whether or not a behavior occurred during a certain time period. Sometimes this can be easier than recording every event of the behavior. So sometimes when we're sitting down and we're running a program with a student, we cannot simply record every event of the behavior on a chart or using a clicker, because we can't do anything else at the same time. So sometimes what we'll do is we'll set a timer for a certain amount of time, like let's say it's 1 minute. So we'll set a timer for 1 minute, and while we're working with the student, we'll observe if the behavior occurs at all. So let's say the behavior is hand biting. So we'll set a timer for 1 minute, and during that 1 minute, if hand biting occurred, we will score a minus, let's say, and I'll go more into the plus minus stuff in a little bit here. So we'll record if the behavior doesn't occur, and we'll record if it occurs in that 1 minute, so that we're not having to lose focus on what we're working on with the student to record every single event. So it helps us better multitask. And that's something that may be included in your home program, or it may not. I'm not going to go into that in any more detail. I hope I haven't already confused you, but I wanted to throw it in here because I think it is a very valuable method that isn't implemented often enough. It's much more feasible often for a parent to do time-based sampling versus recording every single event of a behavior. Okay, recording behaviors. So why do we record behavior data? Well, we need to know if our intervention or treatment is effective. Data helps us identify progress and make program decisions. Data also helps us identify patterns in behavior. So if we are taking data every single day on vocal protest, for example. So that might be refusing to do something, or screaming or crying. We may be able to determine patterns in behavior by looking at the student's graph. So we could see maybe on Mondays that vocal protest occurs more than any other day of the week. And that's because the student doesn't have sessions on Saturdays and Sundays, and Monday is their day where they're getting back into the routine. So we can kind of identify patterns of behavior by graphing all of our data. Data is also a record of the student's strengths and challenges. So it's important for us to have data as the student's health record. It shows where the student's strengths are, it can show where the student's challenges are, and it allows us to make treatment decisions to support maybe where the challenges are. And it also helps us identify variabilities in program implementation. So sometimes one BI might run a program differently than another BI, or one BI may ignore vocal protest and the other BI might comfort the student every time they engage in vocal protest. So we'll see the data really fluctuate depending on which BI is running the session based on the data. If we weren't taking data, we would have no idea what was going on as to why vocal protest was fluctuating so much. So data can be really helpful for that as well. Okay, so one way of recording behaviors again is count and frequency. So this is a snapshot of my behavior frequency chart that I use in my home programs and for my school clients. So on here, we use one column each day. So at the beginning of the session or at the beginning of the day, if we're at school, the BI or EA will write down the date and their initials, and then they will use tally marks to record the number of times each of these things occur. Now you can see on here above that gray line that we're measuring vocal protest and we're measuring elopement. So those are challenging behaviors or behaviors we may be trying to reduce or replace. And then you also see below the gray line that we're also recording mands for help, which is requesting help, and manding or requesting for all done, to be finished an activity. So those are behaviors we want to increase or skills we want to increase. So again, we're not just measuring behaviors that are challenging, we're also measuring skills or behaviors that are adaptive, that overall increase the wellness of the student. So here's an example of a completed day on this behavior frequency chart. So on this day, vocal protest occurred 2 times, so I have 2 tally marks there. Elopement did not occur at all, so there's a 0 on there. Mands for help occurred 5 times, so the student asked for help 5 times. And then mands for all done, the student asked to be finished with the task 3 times. Okay. All right. Another method we can use for recording events of behavior is a tally counter. So if you shop at Costco, you've probably seen one of these before. They use this to count how many people are in a store at one time. So that's another way that we can count behavior. So every time a behavior occurs, we can click the counter. And at the end of the session, we can look at the counter, see how many times the behavior occurred, and then we would graph that number. I love using these counters for early intervention programs when we're measuring a ton of different behaviors that are challenging and behaviors that are also things that are skills that we want to increase as well. If you're interested in purchasing some of these, if you don't already own them, Amazon is a great place to buy them. You can buy them now in packs that have a bunch of different colors. So your BI could use like the orange clicker for counting number of times a student asks for help. They can use the black clicker for vocal protest. They can use the blue clicker for events of elopement. You can also write on the side with a Sharpie what they're for as well. So it's really nice to have these at hand for counting behaviors when you don't want to have your paper and pencil out recording behaviors on a frequency chart. All right, so once we count the behaviors for a session, then we are going to graph that. I will go over how to read a graph in a little bit here, but this is just an example of how we would graph the number of events of vocal protest from our clicker at the end of a session. So at the end of the session, I would look at my silver clicker for vocal protest. Let's say it says 4, then I would graph a 4 on my graph here for that day. And then my next session, I look at my clicker for vocal protest at the end of the session, and then I'm going to graph an 11 because it said 11, and so on. Okay, so we may also want to take data on the duration of behaviors. That's how long a behavior occurs for. So here's an example of a quick little duration chart that I made on just Microsoft Word. So I write down the date and initials, the time that the behavior started, the time that it ended, the total duration based on the times we recorded. And then I just put a little kind of checklist style thing here beside it. So here's an example of it completed. So we're measuring the duration of vocal protest and playing games on iPad for this student. So for this student, we're trying to reduce or replace vocal protest, and we're trying to increase playing games on iPad. So we want the student to watch less YouTube, and we want him to play some educational games. So we're trying to increase the duration of playing games. So the example here, I have my date and initials there. I have my time that he started playing on the iPad and the time that he ended, and then the total duration is 2 minutes. Another method for measuring duration is a stopwatch. So you can start and stop the stopwatch each time the behavior starts or stops. And at the end of the session, you can graph the total duration. So this is where you would reference your stopwatch at the end of the session to see how much time total is on there. So an example of this for one of my students is that he is to independently transition to his session when the BI is ready to work with him. So we say, okay, Joey, we're ready to work with you, and the BI starts a timer. And the student receives reinforcement in the form of some fishy crackers if he transitions to session within a few minutes, whatever his target goal is. So it might be 5 minutes. And then we would record that total duration on our graph at the end of the session. So here's an example again. We could record the amount of time the child plays iPad games each day. So maybe mom has a stopwatch in the kitchen, and every time the child starts playing games, she starts it. Every time he stops playing games, she stops it, and she continues to do that using the same stopwatch all day. When child goes to bed at 8 p.m., she looks at her stopwatch. It says 4 minutes. So she graphs 4 minutes. That's how long Joey played iPad games for that day. So that's the duration. All right. Any questions about those measures?
Nothing that I can see.
No, not so far. Seems like everyone's following along.
Great, awesome.
Yeah, actually, I had a quick question.
Sure.
As far as data collected in schools, how we can incorporate that, like if there's an IEP and staff at school, is that something like anecdotally or something that is followed on and it's important to?
Mm-hmm. Yeah, so are you talking about data that maybe like a support worker in a school or an EA would be collecting in terms of reviewing that in an IEP?
Yes.
Yeah, so that's really important. What I like to do is either myself or I support the support worker or EA in graphing the data regularly so that we can look at it at school meetings and IEPs. Particularly the last few months of the school year is often indicative of what we need to put in the IEP come September or October when the IEP occurs. So I'll often have those graphs handy at the IEP to say like, look, we're trying to reduce hand biting. In May and June, hand biting was occurring about 10 times per day. So that's something we need to include in the IEP. but it looks like bolting out of the school has decreased to, one event each month. So maybe that's something that we don't need to have in the IEP anymore. Just an example. So I do think data is valuable in presenting that to school teams, just to share a quantitative look at what the current concerns are.
Very good, very good. Thank you so much. Thank you.
No worries. All right, I'll continue. Okay, skill acquisition data. So this is when we are trying to teach a child a new skill. So this might be a program that they have. So we might be teaching them how to color inside the lines, or we might be teaching them how to tie their shoelaces, or teaching them a relaxation procedure, like maybe deep breaths for calming their body down. So this is where we might want to take some skill acquisition data, so new skills we're trying to teach. So why do we record skill acquisition data? We need to know if our tactic is effective to identify progress and make program decisions. So if we're using a hand over hand prompt to teach the child how to cut on a line, and our data is not looking so good, maybe the hand over hand prompt for some reason is aversive to that student, and they might do better without hand over hand prompt. Maybe a less intrusive prompt might be more appropriate. So we need to know if our tactic is effective. And in my last talk, I did cover tactics, so I highly recommend listening in on that part as well. We talked about prompting and tactics. To keep a record of the students' program goals. So we do need to keep a record of all of the students' program goals, areas where they've made progress, or areas of challenges. So we do need data for that. That's very important. We need to know if a skill is mastered by looking at the data. Also, to identify variabilities in program implementation. Again, this can be an issue with skill acquisition as well, where one BI might be using a hand over hand prompt to teach the child to color inside the lines, and one BI might be letting the student color inside the lines independently. So maybe when the student's coloring inside the lines independently, they're scoring incorrect responses constantly. But when the other BI is running the program as it's written, the student is scoring lots of correct responses because they're getting the prompts that they need. So for skill acquisition data, we typically score responses using the following codes. So correct response, we score a plus. An incorrect response, we score a minus. And sometimes we use a tactic called a time delay procedure. And that's where we're prompting the student based on certain amounts of time that pass before we prompt. And that's where we might use a P plus or a P minus in our data. So every BCBA uses different styles of data sheets. So I've put a few examples in here. So sometimes we'll use data sheets where there is a spot to take our plus and minus data on the top portion, and then we can graph our data on the bottom portion. There's a similar setup here for this one. Another style of data sheet is this one, and this is where we have the program antecedent behavior and consequences actually written onto the data sheet so that the BI can reference that when they're running the programs, and then they can take their data right here beside it. And then they would have a separate graph in their data binder where they would actually graph the data from the session. Here's another example of another style of data sheet. So this is actually from a task analysis. A task analysis is where we take a complex task, like washing hands, for example, and we break it into steps to teach it. And so for this data sheet, each of these items here would be scored as a plus or a minus so that we know how the student is doing with each step. There would also be prompts scripted into here as well for each step. Again, that would be decreased as the student makes progress with the skill. So all home ABA programs must collect data. Our ethics code says that behavior analysts have an obligation to collect and graphically display data using behavior analytic conventions in a manner that allows for decisions and recommendations for behavior change program development. So all BCBAs must collect data on their home program. And this is the same for agencies as well. Also, it's important to note that the client does own the data. It's their health record. This is also in the Code of Ethics. So it's important that if you ever choose to discontinue services for any reason, that you are provided the data from your child's program.
I did not know that you have to provide, that you have to have data with your programming. I know that in the past, many consultants just didn't take data, and that was often a sign of not a very good ABA program. And I've always believed that if you don't take the data, it's not going to happen, right? So yeah, that's good to hear.
Yeah, it's very important to take data, even if we're providing, say, parent consultation and not necessarily a full-fledged home ABA program. We still need to collect some kind of data, and that could be in the form of observation notes or parent coaching notes or whatever it is. It can be descriptive data too, but there has to be some record of what we're doing and the decisions that we're making, because we have to follow what the literature says in terms of making decisions. And the data is the only way we can really do that, some kind of data.
Great.
Yeah. All right, I'm gonna keep going here. Okay, graphing one-on-one. So why do we graph our data? Well, it's to display relationships between the dependent variable, which is a fancy word for the behavior or the skill, and the independent variable, which is the intervention. So we want to know if the intervention is actually working. We also graph our data because it provides summaries of the collected data. So earlier you saw those behavior frequency charts where we were tallying how often a behavior occurred in a session. So if your BCBA comes in, if they look at that sheet with all of the tally marks, they're not going to be able to see any kind of pattern in the data at all, because all they see is a bunch of tally marks on a piece of paper. So graphs are a really nice way to make data concise and something we can analyze. That brings me to my third point. It facilitates analysis of the data. Okay, so graphing basics, types of graphs. So the most common graph that we use in home programs and just in general is the line graph. So a line graph, this is an example. All of the line graphs look quite similar. You could be graphing multiple things on a single graph. So there could be multiple lines on there as well, but it's all a line graph. Line graphs display one or more behaviors or skills. So the line graph on the left there only displays one behavior, and that's vocal protest. Line graphs allow for comparison of data points, and they reveal changes in level, trend, and variability. I'm going to talk more about those in a few minutes. There's also cumulative records. I'm sure you are all familiar with Dr. Henry's cumulative graph that we are trying to bend the curve. We are trying to flatten the curve. We can't actually bend it downwards because cumulative records can only stay stable or increase. You cannot actually decrease a cumulative record to go below a previous number. So the number of responses recorded are added to the total number of responses recorded during previous observations. So let's say yesterday we had 300 cases and today we have 100 cases of COVID-19. That means that yesterday's data point was 300 and today's data point is 400. So we just keep adding each day's number to the previous numbers to get the total amount. So on here, this is the total case count that you're seeing. Again, it will never decrease because you can't take away cases that have happened. And the steeper the slope, the higher response rate, or the steeper the slope, the higher the infection rate. Okay, so we're trying to bend the curve or flatten the curve. So when the curve is like this, that means there's a high rate of infection happening. Lots of people are getting COVID. And when we're bending it down or we're trying to flatten the curve, that means that there are less COVID cases happening. Same thing with behaviors. Let's say we're counting the number of times the student says thank you in a session. If the student says, you know, thank you 5 times in a session, we might see their data like this. If they say thank you 20 times in a session, we'll see a steeper slope like that because there's a higher number of responses occurring. Bar graphs is another way that we can show data. It's not super common in home programs from what I've seen, but there are quite a few bar graphs that are included in different research studies. So bar graphs display sets of data that are not related by a dimension that can be scaled, like time. So on a line graph, you'll see that we often record the number of events of a behavior per day on there. So it's scaled across time, whereas a bar graph, you can't do that. So on here, you can see that we're measuring 2 different things 2 times each. So we're measuring the percent of completion of an activity during baseline. So that's a time when there's no intervention happening. And we're also measuring the percent of completion again when we're generalizing a behavior, like let's say out in the community. I won't go into too much detail with bar graphs because I don't want to confuse you. It's more of a thing that's done in experimental literature versus home ABA programs. There's also semi-logarithmic charts, also called standard acceleration charts. These are used by people that use the tactic of precision teaching. I don't use precision teaching, so I am not qualified to really speak on this. If your consultant does use precision teaching, I highly recommend that you receive training from them on how to interpret these graphs. And then there's also scatter plot graphs. So this is something that we can actually use in a functional assessment to determine the function of a behavior, something we talked about earlier. So with scatter plots, data points are not connected and patterns suggest relationships. So we look for clusters of data points. So you can see over here, we're looking at clusters of bolded data points here. Can be used to take rough data on times of the day that are associated with challenging behavior. And it can also be used to collect functional behavior assessment data. So on here, you can see when these behaviors are occurring throughout the day. So at the bottom of this graph, it shows Monday, Wednesday, Friday, Saturday, Tuesday, and each interval throughout the day, which I think it looks like time of the day. So these are actual times. So I think that they're going backwards here, but they're recording when behaviors occur and how many times they occur throughout the day. So you can see during this period of the day, behaviors occur at a higher frequency than maybe this time of the day. Sorry, this time of the day up here. Again, scatter plots aren't something that we typically use in home ABA programs. It's something more that you'll see in the literature. Okay, and this is something that I really like to use in my practice, and I thought I would share it with you here. It's a combination of graphs. So every month when I have my team meetings on my teams, we also look at a graphic display of the students' progress across time. I love this graph because it's really easy for parents and BIs to read, and it's very reinforcing. So there are two different graphs on this graph. One graph is a bar graph and the other graph is a line graph. So on this side, we're looking at the number of learn units completed weekly. Learn units are the number of instructions presented in a week. So an instruction is something like, show me the cat when we're looking at a book. That's a one instruction. So we're counting how many instructions we give in a week in the student's home program. All right. And then on the other side here, we're looking at the cumulative number of short-term objectives mastered. So short-term objectives are small goals to reach a large goal. So perhaps for this student, it's labeling objects in a book. That might be one of their short-term objectives. So the bar graph component shows the number of instructions completed weekly. So in this week, there was about 340 instructions presented. In this week, there was about 475 instructions presented. And then the line graph shows the number of short-term objectives the student has completed since they started their home program. So this particular student has completed about 210 short-term objectives in 29 weeks, which is quite a lot. You can see here, this is really interesting, that you can see here that there are a lower number of instructions completed than here. So in week 26, there were less instructions presented than in week 27. You can also see that when more instructions are presented in week 27, there were more short-term objectives completed that week. So when there are more instructions presented, there are more short-term objectives mastered. So I really like that it shows that. It's just, it reinforces the importance of having consistent sessions for this student. All right. Any questions about those things?
Okay, I just I don't see any questions yet, but I was wondering if there was a new team and there is kind of, you know, the staff, the BIs are getting prepared and teaching the new skill and responding to any problem behaviors according to the plan, and the time it builds to, you know, have everyone on the same page so that they can all be recording their data as expected. Do you recommend that for progress monitoring, the data is important to meet in the initial stages, maybe more than once a month for the team with the ABA consultant?
Yeah, that's a great question. So I think it just depends on the consultation model overall. So, I mean, for my teams, when I'm working with early learners, I don't just come to the team meeting every month. I see the student for multiple observations as well. But I think for actual team meetings, when everyone comes, it's really dependent on how many sessions the student has in a week. So if the student has a very intensive program where they're receiving 5 or more sessions each week, then yes, I think it's really beneficial to meet perhaps twice a month, so every 2 weeks as a team, to review the student's progress and go through any training items, making sure that all of this data is being collected accurately. And also with more therapy hours, typically there is quicker progress as well. So you'll want to meet more frequently so that you can introduce new programming and have your BIs well trained to actually move quickly through a program.
Okay, that's great. Thank you. And I guess along those lines, the other thing would be just the recording of the description of the behavior. If it's detailed enough and if everyone is describing it in the same fashion. I know if it's scattered or they were looking way scattered, or if someone else described it as they were hyper focused on something, you know, if everybody recognizes the behavior in the same terminology when they're recording it. That's another thing I wanted to ask.
Mm-hmm. Yeah, so I think there's 2 pieces to that. So one is that when we are recording frequency data, so that's tallying how many times a behavior occurs in a session, it's important for the BCBA to train people on what that behavior actually looks like so that it can be recorded accurately. The biggest question I get during training is, if the student's engaging in a behavior like vocal protest, when does one event of vocal protest stop and another one start? So if student is screaming and crying and then they stop for 5 seconds and then continue again, is that one event of vocal protest or 2? So I think that's something that's really important to make sure that BIs are aware of, is how much time has to pass between events for them to be classified as 2 different events or more events. So that's one piece of it. I think the other piece is when we're looking at ABC recording, where the BI is actually having to write down what happens, is training BIs during their initial training to make sure that they are being objective with their recording and not subjective. So the BI should not say the student looked anxious, because I'm anxious right now. But my anxious looks different than, Joey's anxious. So it's important that they actually learn to write down the observable parts of the behavior. So he was clenching his jaw and looking downwards, or he began to rock in his chair and hum to himself and look away. So teaching BIs during that initial training is really critical to having them be observant to those observable parts of the behavior that we really need to look at in order to get the big picture and analyze that behavior, to either reduce it or shape it into something that's a little bit more adaptive for the student.
Okay, excellent. Thank you so much, Elizabeth. And I guess that would mean that the BIs that are working with the child, they will have to build some kind of initial rapport and get to know the child on a deeper level, so that they know that if, the function of the behavior, if it's something because of a deficit in their skill set, or if it's because of maintaining some kind of interaction or something like a negative consequence, or they want something they're trying to get that they can't request properly, or if it's an actual deficit in their skill set. Is that something that you can talk to as well?
Yeah, I think this all goes back to the importance of training BIs very comprehensively before they work on their own. So again, every consultation model is very different. And I think this is where it's important for families to ask consultants how they will train BIs. Is like, when I train a BI, if they have no experience, they get a minimum of 15 hours of training with me before they can work on their own. If they're not competent after 15 hours, we continue to train them. So this is where it's really important, is training them on these pieces of, like, helping them get to know the student, because we already know the student a little bit. We did an assessment. So helping them get to know the student the way that we know the student, getting to know those behaviors, getting to know the student's program, knowing how to record data, respond to data, and all of those pieces. It's so important to have a well-trained BI, because they are implementing the intervention. If they're not well-trained and they're not competent, they're not going to do what you want them to do. So all of these pieces are important in that training component. So I like to start my training with theory training. If it's a BI that's never worked with me before, they get 3 hours of ABA theory training, and we go through the student's whole program binder and their behavior plan together. And we role play for the rest of our 3 hours if we have extra time, which we usually don't, because I talk a lot. So, and then we move into actually working with the student and applying all of the things that are in the student's behavior plan and program binder. So all of that stuff is super, super important for actually really intervening accurately on these behaviors and knowing what we're seeing and what to do about what we're seeing.
I was just going to say that we also had BIs just overlap with other BIs. It's quite expensive to have a meeting. So even just having them overlap each other for a shift is way cheaper than having a consultant in and all the BIs, so that's also a good thing. And especially right after they've finished their training, get them to overlap another BI, because sometimes they pick up on something another BI is doing differently than the lead BI. So it's just really good to keep that overlap happening.
Mm-hmm. Yeah, definitely. And I have to say, that's been one of the challenges with COVID, is that we're having our team meetings and things virtually now. So the BIs actually aren't getting to see each other working with the student as often. And I have noticed differences in the way that BIs are implementing things, because they don't get to see each other. So now when families do have access to an iPad, I ask the BIs to spend some time videotaping themselves running the session. So when the other BI is in, they can just pop open the iPad, watch the video, just to make sure that they have some kind of reference for what each other are doing.
Great idea. Yeah, it's interesting if someone had done a study during COVID to see how things are different when we can't do as much of that overlapping.
Mhm.
Mm.
Yeah, exactly. Yeah.
Okay, great. Thank you so much again.
No worries. All right, I'll continue here. Okay, so we're going to look closely now at line graphs because, like I said, this is the most common type of graph you will see in a home program or any ABA program. So there are different components of a line graph. So on this graph, the red dots are called data points. The red lines on this graph are called data paths. In this graph, the dashed line is called a phase change line. So the phase change line is something that we put in when we make a change in a program. So for example, here you can see that there was 4 events of vocal protest and then 6 events of vocal protest and then 10 events of vocal protest. The vocal protest is increasing. So we need to make a change. Our current intervention for vocal protest is not effective. It's increasing. So let's say we made a change to the program. We put in a dashed line to show that we've made a change. And then we continue here with our change tactic. So 9 events of vocal protest, 6 events, it's decreasing now. So that means our tactic is becoming more effective. So we'll always put in a phase change line when we make a change to a program. It's the same thing with skill acquisition programs. If on your first objective, the student is getting a hand over hand prompt to color, and then we are actually decreasing that prompt in the next STO, in the next short-term objective to be maybe just a partial prompt or something like that, we would again put in a phase change line to show that something has changed in terms of our intervention. The phase change line is what helps us analyze our data. If we didn't put that there and we kept connecting all of this data, how would we know what data is from hand over hand prompt versus model prompt? We wouldn't know. So it's important to put that change line in there. We don't connect data points across a phase change line. All right, data analysis. So one of the parts of data analysis is looking at variability. So we want to see how much the range of the data points varies around the mean or the average. So in this top graph here, we can see that the data is quite stable. It's not variable, it's not moving around. All of the data is at an average of about 80%. If we look at this graph down here, our data is extremely variable. Our data points vary from like 95% to 20%. So that's a lot of variability. The scores are very spread out. We don't want data that looks like this. We want data that looks like this for the most part, as long as the data is at a high level, which we'll go through in a second. Okay, the trend. So there are different kinds of trends. The overall direction taken by the data path is the trend. So we talked about data paths a few minutes ago. Those are the lines in between the data points. That's the data path. So if the data path is going up, then it's an increasing trend. If it's pointing downwards, it's a decreasing trend. And if it's staying stable like this, then there's no trend at all. So for example, here is a trend. You can see that the number of events of vocal protest are increasing. I drew a little trend line here for you as well to show that the average is increasing. So that means that the trend is increasing. On this one, we can look at the data and see that the trend is actually decreasing. So vocal protest is decreasing across time. And in this graph, you can see that the data is variable. So it's bouncing up and down quite a bit here. And the average is kind of in the middle here. There's no trend here at all. It's not increasing, it's not decreasing, it's all over the place. Another way that we can look at the data is looking at the level of the data. So we can describe data levels as being high level in the green, moderate level, or low level. And it's just the position of the data set. So if we're looking at this one here on this graph, it's a 0 to 100. So let's pretend that's percent, 0% to 100%. If a student's scores are all up here, and let's say we're practicing sight words with them, and their data is all in this high level, we can say the level of the data is high, which means the student's performance is high. If the student's data is all kind of in this range here, it's at the moderate level. And if the student's data is here, it's at the low level. Again, as you could see in the previous slides, the trend can bounce around. There can be a lot of variability in the data, and it may bounce around between all of these different levels. But this is just another way that we can describe what the data is doing. So for example, as a behavior analyst, if I come in to see a student and we've been running a short-term objective with them for a little while, and it doesn't appear that the student is going to actually master that objective, I'll take a look at where the data is. If the data is at a high level, but the student hasn't mastered the objective, then I know likely it's a problem with reinforcement of the behavior. So then I can make a change accordingly. However, if the level of the data is down here in moderate to low, I know that it's probably not an issue with reinforcement, but it's an issue with something else. So, and that's just something that I know because I'm trained as a behavior analyst. It's not something you're expected to know as a parent or a BI, but just a little bit of insight into how we can make decisions based on the data. So from this, you can see just how important it is for us to collect data. If we don't collect data, we cannot solve problems systematically like this at all. Any questions about that? I know that was a bit of a loaded section and it's a bit technical, but I do want to provide that for parents that really are interested in that really, really technical stuff. It's not a requirement at all, but I think it's really, I'm a bit of a data nerd, so it's interesting to know about those things.
We don't have any questions. There's one that came to mind, I jotted down, was the importance of the day-to-day sleep and eating schedule and how the child's feeling, and that being communicated from parents to the the ABA therapist and consultant, and how important that is for keeping consistency with, I guess, you know, everything is with eating and sleep is as scheduled, kind of thing, you know.
Mm-hmm.
Wondering if you can comment on that.
Yeah, I think it's really helpful for us to know how to best approach our time with the student on any given day. We do know that individuals with an ASD profile can have challenges with things like sleep and diet. So it's important for us to know when something is a little bit off so that we can maybe do our session a little bit differently that day so that the student can still be successful. So things like sleep can be recorded using formal data collection. So we could graph sleep if we wanted to, or it could just even be a verbal report like, you know, hey, he didn't sleep the best last night. He's awake now, like he's fine for a session today. But just so you know, he didn't sleep the best. So then maybe during that session, we may adjust to do a little bit more play, maybe less transitions between play and work, or maybe we won't go to the park that day because it might be challenging for the student to cooperate with walking with us, or something like that. So we do want the student to be successful in their session, and those things can actually be a setting event for the student to not be successful. So I think it's important to have those open lines of communication. And of course, if sleep and eating and things like that are ongoing challenges for the family, I think it's also important to address those challenges with your behavior analyst, because they can likely help you with the sleep or the eating.
Yes, it's very important to have that.
Yeah. All right. I'll keep going here. Okay, more about the data. So let's go through how we graph some data now. So going back to our behavior frequency chart that we looked at earlier, we were doing some event recording. So we were recording all events of vocal protest using a tally mark, and then all events of elopement using a tally mark as well, also Mans for Help and Mans for All Done. So here I have 3 days of just sample data from a behavior frequency chart. And I have graphed the data here for vocal protest only, okay? So each of these behaviors that we're measuring, we're going to graph on a different graph because we're likely using a different intervention for each of them, and we want to analyze them separately. Just because vocal protest decreases doesn't mean elopement's going to decrease, so we need to look at all of these things kind of separately. If we want to look at them together to see if there's a relationship between vocal protest and elopement, I still use paper and pen data collection. So I will just lay my graphs on top of each other and hold them up to a window, and I can see both graphs through the paper, and then I can see if there's any kind of relationship between the two there. So you can do some very low tech things. For the purposes of this presentation, I have graphed all of my data in Excel for you so that you can see the fancy version. So for vocal protest here, you can see that on May 30th, 2 events occurred. On June 1st, 3 events occurred, and on June 2nd, 1 event occurred. You can see my graph here that on the first session that we looked at, so that's May 30th, 2 events occurred, that's 2. And then 3 events occurred during the next session, and then 1 event occurred on the next session. So we would just keep going and going here and connecting our data points as we go. If at some point we see that our vocal protest is increasing and we need to make a change, we would put a phase line in this graph. Okay, and then graphing skill acquisition data looks a little bit different. So if we're looking at graphing skill acquisition data here, using pluses and minuses, a data sheet could look like this. Again, this will vary depending on the practitioner. But if we're looking here, we've taken all of our plus and minus data along this column. Again, plus is correct response, minus is incorrect response. So when my column of data gets full here, I'm going to add it up. So 14 out of 20, I put my date and my initial, and then I'm going to move on to the next step, which is graphing. So after I've added up my data here to 14 out of 20, I'm going to put a 14 on my graph here so that I can track my progress. When the BCBA comes in again, sometimes this data can be helpful, the plus and minus data, if we're solving problems. But most often we first look at the graph because that's just the easiest visual display for us to analyze to see how the student's doing. Reasons why we might look at this plus and minus data would be to see when the student is responding inaccurately. So I have some BIs who will run a program like, let's say the student really loves puzzles. So they will do lots and lots of learn units or instructions of a puzzle. So many that the student gets bored and then starts responding incorrectly. So I want to see how many instructions of puzzle did they present in a row. Does the student's responding decrease as there's more instructions presented? That might be an easy program change we can make. Okay, I only want you to run 2 puzzles every session so he doesn't get bored, so we can maintain his responding. So those could be things that we could only interpret from this plus and minus data. So it's important to keep that stuff too. We don't just want to keep the graphs. So if we look a little bit further here, this is the same data, that 14 out of 20. If we have more sessions, we get more data, we would graph all of this data on here. So this graph corresponds with all of this data. So we have 14 out of 20, we have 17 out of 20, we have 20 out of 20, and we have 19 out of 20. One thing that some newer BIs can forget to do at the end of session when they're doing their end of session data collection is adding up these columns of data and graphing them. There's a lot of things that need to be done at the end of a session. It's really tricky to remember them all, but this is important because if you don't add up your column of data at the end of the session, how do you know if the student has mastered that activity or not, that program or not? You don't know. You need to graph it and you need to add it up to know. So this is something that's really important for the BIs to do. And we might also graph skill acquisition data using percent. So we take our plus and minus data, but we may actually score it as a percentage score instead of a score out of 20 or score out of 10, whatever your behavior analyst uses for measurement for a particular program. And percent data is often taken when there are a different number of instructions presented every time the task is done. So an example here for you is when we play a board game. So let's say I play Hungry Hippos with my student, and we're taking data on every time he waits his turn and takes his turn for Hungry Hippos. Now, every time we play, we might play for a different amount of time. Like he might want to play like 10 different games one day and then like one game the next day. So we need to be able to find a way to average out our data, and that's percent. So here you can see that we took data on taking and waiting turn for 13 different opportunities. And then the session was over. So we just crossed out the rest of that column of data and scored up what we had for that session. Same thing for these other sessions. It varied how many times that Joey wanted to play Hungry Hippos. And then we graph our data. So at the end of each session, we're going to graph our data. So we have 69%, 81%, and 92%. This is an increasing trend. You can see that the data is increasing. It means the student's learning when it's increasing. If it's behavior data that you're trying to decrease, like vocal protest, if the data path is increasing, of course you don't want that. You want the data to be decreasing or at least staying stable. But for this, because it's skill acquisition, it's great. He's doing well. Okay, criterion or criteria. So just a short note on this, and this will vary again by practitioner, but the criteria or criterion is the level of performance required to consider a skill mastered or that you've reached the result of an intervention if you're trying to decrease or replace a behavior. It sets the standard for evaluation, and it's chosen based on the skill to be developed, the behavior to be decreased, etc. So the criterion for a sight words program might be 90%, but the criterion for crossing the street is 100%. So it's going to depend on what skill you're trying to teach, right? Because with sight words, if the student gets a few wrong, it's okay, that's part of learning. We're never going to be perfect at everything, but if you don't cross the street safely, you're going to lose your life. So the criterion for that skill is essential that it's 100%. It's the same thing for self-injury and aggression. We want to decrease those behaviors to 0. We do not want those behaviors to occur at all, okay? So some criterion statement examples, and again, this will vary based on the practitioner, and I'm sure you've seen this vary too in things like IEPs. So examples of criterion statements, 17 out of 20 correct responses for 2 consecutive sessions. It's wordy, but I'll go through it with you in a minute. With 80% accuracy, on 80% of opportunities for 10 school days. This is kind of an IEP style one. 4 out of 5 trials correct, or on 5 consecutive trials. So those are just some examples of what criterion can look like. So here's an example. The criterion for this program is 2 times 18 out of 20 or above consecutively. The translation of this is 2 columns of data. So this is a column of data, this is a column of data, this is a column of data, and this is a column of data. So there's 4 columns of data here. 2 columns of data with a score of 18 out of 20 or higher in a row. That's what that means. So if we look here, we want to see if we have 2 columns of data in a row with a score of 18 out of 20 or higher. So it looks like here, these last two, we have 2 columns in a row, and they each have 18 out of 20 or higher in them. So that's great. That means the student has met mastery criterion. We can move on to the next goal or the next step of that program. And you can see that circled here. You can also see it on the graph here as well, where they met criterion. So it's kind of nice to have the plus and minus data and the graph because you can see 2 ways that the student has met criterion. Okay, so we're nearing the end of the presentation, but some final thoughts that I shared last time that I think are also important here is that there's no right amount of parent involvement because every family has different needs. You should ask questions and seek clarification from your provider, or you can ask me now too. And request training from your provider specific to your child's treatment plan if you're able to. I have some references here from some of the materials that I've used throughout the presentation. If there's any of these research articles that you would like a copy of, you can contact me to request a copy. And you can come back for more next week. We have part 3 of this series, which is applications of data-based measures, pre and post diagnosis. However, if there's anything I missed in this presentation or any specific questions you'd like me to go into more detail in my presentation next week, I'm happy to cover those things as well. You can reach out to me and let me know, and I will create some slides to cover those things for you. And then any final questions that you have about the topics that I covered today or last time, or anything else that you'd like to ask me about.
Thank you very much, Elizabeth. And I want to tell everyone that Elizabeth has volunteered her time to share these slides and this presentation with us, because it actually saves the parents a lot of money. Because if you're getting your own consultant to explain all these things to you, you're paying them for that time. So this is really helpful for parents if they can spend some time looking at this. We'll have the videos available as well, so you can look at it again. And then we've got part 3 is already available to get your tickets for, because it's next Tuesday. And I just put the slides in the chat there, so you can click on that, and the slides are available, but I'm also going to send them out in the email to follow up along with the video recording. It takes a few days to get the recording, so just give us a few days. So thanks a lot, Elizabeth, and we'll see you again next week. And I also wanted to just let our participants know that Shada, who was with us in the beginning there, she's here as well still, is one of our educational coordinators who works in the Pacific Autism Family Network Center, the building for the Autism Support Network. And she runs a meeting in Farsi as well. But she's also available to talk on the phone with parents or answer questions by email, as is Elaine Waddell, who will be with us next week with Elizabeth's 3rd presentation. And so we've got a comment. Thank you for this talk. Thankfully, this was a review, and it's good. This is what, when you feel good, is when you're seeing a presentation and you're saying to yourself, yes, I know this now, right? That's a good feeling. This would have been priceless when first starting up. What a gift to the parents. And please, Jennifer, share that on the events and Facebook, because that will help other parents see it and know to come for us next week. And Shada, you got some more, anything else to say there?
I just wanted to thank you, Elizabeth, for your time. I think it was great to have this. It's a very suitable time, as it was very timely for this presentation, you know, with COVID and parents trying to figure out how to translate what they see and the effectiveness of their data collection. They can now refer to these slides and see what really it is meant to be for data collection and its importance in ABA. So I just wanted to say thank you to everybody, and I hope you've all enjoyed this workshop. Please leave a comment on the events posted on our Facebook page. This can encourage other parents to attend this 3rd workshop and see the first 2 videos so they can get this valuable information. And also, just to say, for the next part 3, it's next Tuesday night And you should join us with Elaine Waddell. She's our other education coordinator, and she will be hosting this part 3. And Elizabeth will explore taking data pre and post diagnosis. So that's really, really helpful to learn about. So yes, and we will be following up with an email, and really appreciate everybody attending. And thank you so much, Elizabeth. We really appreciate your time and your knowledge.
Thank you. Thanks for having me. I really appreciate it.
Thanks. Goodbye, everyone.
Bye.
Thanks.
Take care.
Goodbye. Bye-bye.